Why is health equity important? Health equity is important because it defines who we are as a country.
They should care about health equity because it pertains to all of us.
So it might start with your neighbor. It might start with that person who's 1,000 feet away from you, or maybe 1,000 miles away from you.
It is society's commitment to achieving the highest standard of health care for all people.
Everyone in this country is entitled to the same level of health care, whether you're African American, Asian American, Hispanic, regardless of your geography or socioeconomic status, regardless of your disability status or any other category that you fit into.
What we're trying to do is actually erase what we call health inequities. Now, what are health inequities? Health inequities are those differences in health status that have to do with economic, social, and or environmental disadvantages.
Often what people want to talk about is medical care, but medicine is only one part of a whole continuum that starts with prevention and things that are a part of our daily lives.
Especially when you look at populations that are known to be disproportionately impacted from an educational or an economic standpoint.
What does health inequity look like for Native Americans, American Indians, and Alaska Natives? It looks like communities where life expectancy is 50 years of age.
Where you live is a big portion of how long you live, even within block-to-block zip code dynamics. So we know that geography is important.
Culture and ethnicity play a huge part in it, but it's not the only part. We also do a lot of reports that look at the socioeconomic conditions that affect those populations. We also recently did a report that included information about those that are disabled.
I've seen it a lot in the populations here in the Great Plains that a lot of individuals don't have access to those facilities and the proper care and services that it's led them to get a chronic disease or a late stage diagnosis.
There are communities, there are areas where maybe there's conversations around language access, for example.
The social determinants of health are very important. The conditions in which people are born, in which they live, grow, learn, work, play, and even age.
Is NPA, helpful in helping to overcome some of these challenges and these barriers? I believe it is.
The NPA started the whole movement for minority health, the elimination of health disparities, of the mobilization of people at community levels throughout the whole country.
So when it was created, the whole idea was to create this platform where we can apply the strategies we know work.
The first goal of the Partnership for Action is just making people aware. And that's why it targets awareness, because that's our first shot at raising the consciousness of the people.
When we talk about the goals of the NPA, about how do you create changes at various levels, when you look at leadership, you need leadership to drive and set the vision, certainly at the local level.
Health systems and life experience is our third goal. And with health systems and life experience, we actually are talking about the social determinants of health. So this is the goal that says we need to tackle education, we need to tackle housing, we need to tackle transportation. And then we have a fourth goal, which is cultural competency and linguistic appropriateness.
And it really just takes a little bit of a conversation, right? And sharing some of the statistics and sharing some of the challenges with learning English in another country.
The NPA is a critical partner in reaching the objective of increased data. We need more data to tell our stories in Indian country and to tell stories across cultures. No one can do this work alone, and together, collectively, making data available and using it in a smart way will make a change for the better for the future.
So we have Office of Minority Health. We have offices of minority health in different parts of federal government. There are 40-something state offices of minority health.
The Federal Interagency Health Equity Team convenes federal leaders to end health disparities, and we hope to end health disparities by cultivating strategic partnerships, by sharing and disseminating relevant models for action, and also by building capacity within the federal system.
And so by having NPA and then also having the Regional Health Equity Council Network, it really creates this opportunity for the region to have these conversations, and also from region to region to share the best practices.
Philanthropy has a very important role to play in this. So you're also seeing where corporate leaders and folks from the business end, certainly some involved in NPA and certainly others outside of that.
Partnerships like NPA is a silver lining. That gives hope to all people who are suffering from health inequities.
Nobody can do this work by themselves. Nobody is imbued with all of the skills, the knowledge, the everything that they need. And so it means that we need the traditional system, we need churches, we need fraternal organizations, we need the old mother of the neighborhood who's sitting on the porch that knows everybody's business before anybody else knows it, and probably would be the first line of prevention in a community.
We are seeing accomplishments from the standpoint that certain things are put in place now. Having federal oversight is a huge accomplishment. Having state level oversight is a huge accomplishment. Everything from class standards to federal and state level oversight, to having local coalitions to focus on health equity and health disparities, to putting together regional health equity councils.
We have to remember this is a marathon race, not a sprint. So we see all these incremental kinds of things happening at the local community level and partnerships being formed that create both the soil and the ingredients for change.
How do you integrate that equity lens into how you think, how you do your business, how you shape your policy? It has to be that constant lens in the back of your mind each time you do your work.
So what will it look like when we achieve health equity? It'll be so seamless because things will be fair and balanced, and the parity, everything will be there. So there will be nothing for us to see that is broken or uneven.
I visualize it as everybody living long, healthy lives and being able to do all the things that our ancestors were able to do for generations and generations.
It's not just about the individual and their behavior and how they can change their own health, it's about changing our environments. And if we can all work together to change environments, then we will be able to advance health equity.
All those pieces will help make a community stronger and help that individual access health when they need it.
When we get to the point that we have true health equity, it isn't going to matter how much money is in your pocket, or whether you're male or female, whether you're rich or poor, whether you're old or young, whether you're rural or urban. It will be the same care based on the need.